So now I'd like to sort of discuss, provided that you look into your history, family history, health-wise, you see a doctor and there are some tests done, and you find out that, let's say, you have also hyperlipidemia. And let's just say, how do you handle this? Which is really most common. You know that you have a family history, and you went to a doctor, and they did a test, and let's say you are 40 or 50 or 60 years old, and you do have hyperlipidemia. What do? You naturally have to have a complete examination by the doctor. Make sure you don't have hypertension. You have to have some blood tests and tests to make sure you don't have diabetes, particularly if there was a family history of diabetes. And then you have to have blood analysis to see what type of hyperlipidemia you have, what type of good cholesterol is up sufficiently, which should be, let's say, HDL, and bad cholesterol is low, hopefully that's LDL. And then dependent on those findings, your physician will should advise maybe, particularly if you have family history of any of these illnesses, that is family history of coronary artery disease, diabetes, hyperlipidemia, then you should have definitely, after age 40, I generally tell the patients, you should have a cardiac stress test. I think that's probably electrocardiographic stress test, which is very simple. They do an electrocardiogram at rest, put you on a treadmill, you exercise during and after exercise. Your electrocardiogram should not significantly change. And if it did, or if you develop symptoms, that will be added information that you may, in fact, already have started to have coronary artery disease. And then you will pursue that with the additional studies, which may be what we call calcium scoring. Find out with the help of the CT scan, find out if you have any calcium deposit in your coronary arteries, which can be easily seen, and it's called calcium score. Or you will have what we call non-invasive coronary angiography, CT coronary angiography, if warranted, particularly if there are some suspicious symptoms. You also could eventually need to have, if there are strongly, your stress test is definitely positive, or if you have a high number of the calcium score, you may need what we call selective coronary angiography, because that's the only test that eventually can lead to some intervention. And now there are so many things that can be done. One of them is stenting coronary arteries when there is a significant blockage, and that is if that's a very important artery and you have abnormal stress test or you have symptoms naturally. At that point, you might have a selective coronary angiography, and then remedy that blockage by a stent. Or in situation when there are multiple areas of disease, or in very important sites of the coronary arteries, you have some blockages by coronary angiography, selective coronary angiography. You may be chosen and advised to have coronary bypass surgery. particularly if coronary angioplasty may be difficult to do or will not provide you with a good result. So you find out first whether you have problem. After that, there are so many of them that can be resolved one way or another to help you to lengthen your life, and also if you have any symptoms to resolve your symptoms.